Welcome back. This is Sleep Better TV. I'm Scott Drake. We continue our discussion with Dr. Larry Pribyl. He's with the Center for TMJ and Sleep Apnea. He practices in Independence, Missouri. Dr. Pribyl, again, welcome back. Are patients typically aware when they're having an apneic event?
Most patients are not aware. They need to be told by their spouse or an observer that they're stopping their breathing pattern. Although sometimes they do realize that they're not breathing when they wake up in a gasping mode. But overall, most of us are not aware that we are having these apneic events.
Now, I'm sure you get this question a lot, but is there anything the patient can do to sort of self-test themselves to see if they might have sleep apnea?
Well, we talk to patients about the importance of nasal patency, which is being able to breathe through your nose easily and with unobstructed airflow. And we'll ask the patients to do what we call a sniff test. Have them close their lips, breathe hard and fast through their nose, and in a good breathing pattern, the sides of your nose will flare and more air is delivered to your lungs. So your nose is able to deliver what your lungs are demanding. In some cases, when you do the sniff test, the sides of your nose collapse, you're unable to breathe through your nose. So breathing is extremely important. Our nose is for exactly that, and that's one way to test the nasal airway to see if it's open and patent.
Finally, doctor, I've heard that there's actually a written test a patient can take that reflects their likelihood of having sleep apnea. Is that true?
Yes, there is, and it's called an Epworth Sleepiness Scale. The Epworth Sleepiness Scale is composed of 8 questions, and they're scored 0 to 3 each question, and you add the numbers up when you're all done. If you have a total of 0 to 8, you don't have a high likelihood at all of having sleep apnea, but anything more than 8 is you increase the likelihood that apnea is part of what you have going on. And when you get to 24, the highest score that you can get, it's likely that you may have narcolepsy, or maybe you are a drug user or a drug abuser, which can contribute to that as well.
All right, doctor, great information. Again, thank you.
Thank you.
He's Dr. Larry Pribyl, practicing with the Center for TMJ and Sleep Apnea in Independence, Missouri. This is a continuing discussion on sleep apnea and obstructive sleep disorders. I'm Scott Drake. You're watching Sleep Better TV.